GETTYWomen suffer traumatic events are more prone to becoming obese. The study showed that women who experienced one or more traumatic lifetime events or several negative events in recent years had higher odds of being obese than women who did not suffer such stress. Study senior author Professor Michelle Albert, of University of California, San Francisco UCSF, said, "Little is known about how negative and traumatic life events affect obesity in women. We know that stress affects behavior, including whether people under or overeat, as well as neurohormonal activity by in part increasing cortisol production, which is related to weight gain. 1 in 4 British adults is obese. Levels of obesity, a preventable risk factor for cardiovascular and other diseases, have more than trebled in the last 30 years and, on current estimates, more than half the population could be obese by 2050. Negative events included wanting employment but being unemployed for longer than 3 months or being burgled. We know that stress affects behavior." Professor Michelle Albert study author Dr. Eva Durazo, of UCSF, said women tend to live longer than men, putting especially obese, aging women at greater risk for disease. The researchers studied the relationship between major life events and obesity in a group of 21,904 middle-aged and older women, focusing on those with the highest obesity prevalence. They defined obesity as having a body mass index (BMI) of 30 kg/2 or higher. They measured the impacts of 2 types of stress traumatic events, which could occur any time in a woman's life and include such things as death of a child or being a victim of a serious physical attack, as well as negative life events that had occurred in the previous 5 years of a woman's life. Getty 1 in 4 British adults is obese. They found that nearly a quarter of the women studied, 23%, were obese. Women who reported greater than one traumatic life event compared to no traumatic life events had 11% increased odds of obesity. The higher the number of negative life events reported by women in the last 5 years, the higher the tendency for increased odds of obesity. Specifically, women who reported 4 or more negative life events had a 36% higher risk of obesity, compared to women who reported no such events. Among women who had higher levels of physical activity, there was a stronger association between increasing cumulative chronic stress and obesity, though the reason for the finding remains uncertain. GETTYWomen research measured the impacts of 2 types of stress. Prof. Albert said, "Our findings suggest that psychological stress in the form of negative and traumatic life events might represent an important risk factor for weight changes, and, therefore, we should consider including assessment and treatment of psychosocial stress in approaches to weight management, because the study looks at the association between stressful events and obesity in a snapshot of time." Professor Albert said future studies should look at the relationship longitudinally, following people for weight gain over time after life events have occurred. She added, "This is important work because women are living longer and are more at risk for chronic illnesses, such as cardiovascular disease. The potential public health impact is large, as obesity is related to increased risks of heart attack, stroke, diabetes and cancer, and contributes to spiraling healthcare costs." The findings were presented at the American Heart Association's Scientific Sessions in Anaheim, California.